In this episode of Learn Your Body Thursdays, we're going to be talking about the ankle and everything related to that you need to know to keep it healthy and keep yourself out of ankle pain. Hey guys, happy holidays and happy Thanksgiving to those of you that are celebrating today. I'm filming this right before I go off to do some family stuff, and I'm excited to do that. But I'm also excited to film this episode about the ankle today. And so this is episode 2, where in this series we're working our way up all the way from the big toe. We started last week with the big toe, and we're going to work our way all the way up to the crown of the head, where we're going to talk about everything related to the various joints and some of the supporting structures so you can remain healthy and hopefully learn a thing or two along the way. So today we've landed upon the ankle. And the ankle, as we're going to show in this model, we're mainly talking about the talo-crural joint, as it's called. Now the talo-crural joint is made up of both the tibia and the fibula, and they form a joint that looks like this. It's like a horse saddle. We call it a mortise joint. Whereas the bone that sits underneath that is called the talus. It has a little bit of rounded edge there. And we also could consider the subtalar joint as part of that as well. So that's going to be more in the foot, but it's also that has that heel rocking side to side, and that largely impacts your ankle as well. So when these two bones come together, the tibia and the fibula, they form what's called the distal tibio-fibular joint. And this is a place that provides a lot of stability. This bone is very important for the stability of your lower leg. The fibula is. It's not very thick, but it provides a lot of rotational stability at the ankle and also a little bit at the knee as well. So when these two bones come together, they're joined by a great deal of connective tissue in here called your interosseous membrane. And in runners, a lot of times this area gets very taut, and sometimes you need to go in and release down the side of the tibia. And you might feel this if you run right down the ridge of the inside of your tibia there. You'll notice there's a lot of soreness and tightness in there, especially if your ankle doesn't glide well. So if you're trying to make up for that range of motion by using these muscles on the front of your leg, but you can't glide that talus back into that mortise saddle joint there, then you're going to have some real problems with a lot of the fascia up here. And then you may have problems at the knee as well, which is obviously not shown here, but the knee would be right above there. So we have this mortise joint that has to glide well back in the socket. There's a great deal of exercises that you can do to improve that. You can also have it manually mobilized by a physical therapist or someone with similar training, a chiropractor. Somebody can manipulate this, give you a quick tug of this and pull it down and out, and that will help that to sit that into the joint as long as you don't have any contraindications to that. But very important that that is able to glide well back in the socket, and that also what's going to affect this a lot is the position of your calcaneus. So if the calcaneus is sitting off to one side, if you look at somebody from the back and they don't have their shoes on, you might notice their heels bent one way or the other. If this is extreme, this creates a chain reaction all the way up the knee and also impacts the foot. So in extreme cases, sometimes you may need an orthotic to correct this and bring this back into what we call subtalar neutral. And that needs to be measured by a professional, like a physical therapist or an orthotist, podiatrist, someone of that nature. Because think about it, if this is off to the side, it's also going to bias this joint because that will be tilted off the side and you're going to have a hard time bending at the ankle. So you want to make sure that that is neutral in the socket there, and that is going to set you up, because remember, the first thing that's going to hit the ground when you're walking is the heel. If that's off to the side, you've got a problem and you're not going to be able to transfer your weight well. So when you're sitting, you can do exercises where you have a heel slider or a furniture slider underneath you and slide your heel back. Work on getting that talus back into the talo-crural joint. You can, again, like in the last episode, mobilize these bones around here through the midfoot, wringing out the foot. Even bending on a stair and dropping your heel off the stair may help a little bit with that as well, especially if the calf is short back here. You know, you have your two muscles back on the back side, you have your gastrocnemius, and you also have your soleus. So sometimes you have to, some people will be tight when their knee is bent and they try and stretch it. Some people will be tight if their knee is straight and they try and stretch at their ankle. Ankle stability is a whole nother beast and would require a whole nother video. But it's important to, if you're having stability problems at the ankle, or you've had repeated strains where you've gone out onto the outside of the foot and you've stretched out some of these ligaments a lot, then you don't have a lot of that integrity of the connective tissue there. And sometimes people need things like prolotherapy to shorten some of those things up and provide you some inherent stability. Otherwise, you have to work really hard to retrain your muscular and your neuromuscular system, your brain, to be able to coordinate your ankle better. And some of that will come too from working on hip and ankle coordination, not just the ankle. But don't go ahead and do crazy things like insanely large kicks standing on one leg. You need to break that down into smaller motions. And that usually requires the help of someone like me. So I hope you enjoyed this episode, guys. Next, we're going to work our way up to the knee. I'll spend a little time talking about the space between here again and how that's important, and how some of the motions of the knee and how your ankle relate to each other to prevent knee pain, and what you can do to improve knee pain. This has been another episode of Learn Your Body Thursdays, guys. Hey, once again, happy holidays. If you're celebrating today, Thanksgiving, have a great time, safe time. Hope you enjoyed this video. Check back next week for our episode on the knee. If you enjoyed this video, be sure to subscribe, hit the little bell so you never miss another video again. And I look forward to seeing you next Thursday. Have a good one, guys.